Great.
Well, this is the October meeting of the Citizens Climate Health Team, and we have a great guest speaker and CCLer here tonight. Nikhil Jain is an accomplished osteopathic physician with a unique trajectory in the realm of health policy. He transitioned from a family practice residency and redirected his focus toward his fervor for advancing population health and advocacy. His expertise spans a diverse array of topics encompassing climate change, substance abuse and addiction, HIV policy, LGBTQ health, and more. And he's had an unwavering commitment to climate awareness within the medical community. He's worked hard at the establishment of the South Carolina Healthcare Professionals Climate Declaration, and he's going to be talking about a new model to get out op-eds from healthcare providers. Take it away, Nikhil.
Well, thank you, Lori. That was quite flattering for an introduction. I'm going to go ahead and share my screen here so you all can see the template as well. Are you all able to see it?
Mm-hmm.
All right. Well, thank you, everyone. So I wanted to talk to you all today about a op-ed rollout that we're doing in tandem with the communications team, but also really trying to focus on our health action team and other healthcare providers who are not part of the health action team, but are part of CCL. So as you all know, we do have an election season coming up. So now there's no better time than now to, really get the word out that climate change needs to be a priority for this upcoming election. Especially at a time when we have a House without a speaker, and partisan bickering continues to happen despite the struggle to find a new speaker. I mean, we have to continue to just remind our lawmakers that, hey, let's not forget what our priorities are, and let's not forget why we elected you in the first place. So what Lisa and I have done is worked with Charlotte Ward, who is the state and local media coordinator, to design a template that really tries to get to really tries to create this heartwarming, this heart-rendering message that, yes, climate change is indeed real. Climate change it continues to get worse. And in fact, just look at this year. We've had so many unfortunate climate phenomena happen, including wildfires, hurricanes, floods, you name it. This is a template that, as you can see in the highlighted portions, is personalizable, and we want it personalized based on what the writer, in this case a CCL volunteer, has come across in their neck of the woods. Add any personal stories, and really target this, as you can see here, to their elected officials for that state and for their congressional district. And we want writers to take some creative liberties here and modify this template as needed if there's something else they want to fit. Ultimately, our goal is to try to get this template published to get this op-ed published in all 50 states. But ideally, we want to roll this out to as diverse, as wide a group of healthcare professionals as possible. Lisa, was there anything you wanted to add?
Thank you. No, the only other thing I would add is that it seems like we on the health action team could potentially serve as resources. So yes. If the communication people in a certain chapter, pitches it to their chapter and says, any health professionals here, are they interested in taking this template and, personalizing it to their area and, pushing out an op-ed, many of us have been working a long time in certain areas. So if somebody in the Midwest was interested, I might be able to help with that. Somebody out West, Lori and Rob, there you are. Alan, you could help me in the Midwest. Nikhil, you'd be better down South,
Yeah, I'd be glad to.
Yeah.
Yeah, and I want to say that, we want to try to get as many different stories as we can, because at the end of the day, stories matter. There's nothing more relatable than stories, and that is why our goal is to have as many different kinds of healthcare professionals participate in this effort in as many different locations as we can.
What do other people think?
So one thing I like it. I think it's a great idea, but it has to be pushed a little bit. Just putting it out there for people to look at and see and maybe make use of is not going to work for healthcare professionals.
Agreed. And that is why we are trying to work with the communications team to on the outreach part of things. And I'm glad to help out. Really, if the communications team does need an additional resource trying to identify potential audiences, I'm glad to help out in any way that I can. But ultimately, I do want them to take the lead in identifying potential writers for this in as many different chapters that we can find.
And I think Charlotte better than I do, Nikhil, but she's the media director, under Flannery, that works with people all
Correct.
across the country, pushes out these templates. I don't know if you guys, are aware that most chapters have a communication manager, and they get, these packets of emails, they get an email with a package of templates, once a month or so. And so this would probably be part of it. And then I don't know if Charlotte's talked to you, Nikhil, or not, but what might make sense would be for you to potentially pitch it to the communications managers in the different chapters, something like that. And that might be more consistent with what you're thinking, Rob, in terms of getting it out there.
Yeah, I certainly think that needs to happen, but I think also is using the health action team contacts directly rather than just the communications groups in the various state chapters may help as well, because right or wrong, we know that especially physicians are not very good about listening to people other than other physicians, and even then, not so much.
True. And to your point, Rob, what we also want to do is one potential audience that we identified as nurses. They are, they spend more bedside time than even physicians, and if we can get more nurses to participate, that would be especially great.
Yeah, it's sort of ironic the way it works with nurses, given that there's, at least a scale of 10, if not way more than that, more nurses than there are physicians. In our group, there's probably 10 times as many physicians as there are nurses,
Right.
which we have 100 times fewer CCL nurses that join our team than we do doctors. Because we probably have a representative sample of both. But, sadly, they've been a lot less active in advocacy, and their organization is a lot less active.
I wonder if this isn't a way of trying to identify the nurses that maybe haven't stepped up to use I think there are probably nurses, as we've talked before, I know, Lori, in CCL, but they're not joining the health action team, right?
Right.
So the question would
Yeah.
be, let's empower them a little bit to use their voice, not just to advocate, but to advocate as a health professional, which they
Mhm.
haven't historically been doing, at least within CCL.
And I'm even thinking if maybe we should target some of the other action teams, and try to identify, any overlap, find healthcare professionals in the other action teams who aren't part of the health action team.
Yeah, I mean, we've done that before. We've, sent invitations to chapters, and just asked them to have their health people join us, and haven't got a lot of, didn't really get a bolus of people joining with that. So, yeah, I don't know what other tactics. I mean, I can share with you our list of, I have just a spreadsheet. CCL, and what you find on the list is that when people join CCL, they get a letter, they get a email from us asking them to tell us who they are. And probably 1 in 5, maybe just 1 in 10 will ever respond. So if they respond, I put it on the spreadsheet, but
Yeah.
a lot of them haven't responded.
Yeah,
But
thanks
yeah.
for doing all that work, Lori. I know one thing that I think we've all been taught through CCL, one of the best ways to get an active volunteer is to have them do something. And sometimes, it takes a little effort to get them over that hump, that beginning inertia, which is another reason why I really like this idea, Nikhil, because it seems like this might be an action that if they partnered up with other people that maybe feel, if we're fairly comfortable with doing this, we can maybe help somebody. And then all of a sudden they're an author and they feel, oh, I can do this,
Yeah.
I don't
Yeah.
know, just a thought.
And it's especially a great opportunity for folks who haven't written before to get their name out there and get noticed.
Nikhil, were there specific action teams you were thinking might overlap well? Maybe the environmental justice group?
Yeah, probably them. Um, so hard to say because people's interests are so diverse. It's almost like you'd have to roll this out to all CCL volunteers and see who takes the bait.
Oh, there's her. Thanks, Lori. That she put that membership sheet.
Oh, yeah,
Okay.
perfect. I will definitely take a look at this.
I wonder about another thing, Nikhil. Sometimes when Madeline was still around, when she was, overseeing the group leaders,
Uh-huh.
she would sometimes invite us. I gave several different little, how she does in the group leader call, and maybe Ellie would do it too. Give you like 5-10 minutes to talk to the group leaders about the overall goal of the mission, and tell them that we're hoping that we can identify other health professionals and give them the skills to start writing.
Right. Is that the same group leader call that happens on Wednesdays?
Well, no, I think it used to always be Tuesday nights. As far as I know, it hasn't changed, but
Okay.
I've stopped being a group leader and I'm trying to do other things now. So it's been a while, but I'm pretty sure I still get invited for Tuesday nights. Does anybody else know? Is that right, Deirdre? Tuesday night?
It's Tuesday night.
Oh, I don't have that invite. If someone can share it with me, that would be great.
I
I'd
think
love
the
to.
way to do it would be for us to, maybe we should ask Charlotte first, but to ask Charlotte if she's okay with us. And, I'd be happy to do this. Talk to Ellie, because Ellie's doing the group leader calls now, isn't she, Deirdre?
She has been, occasionally, I'm trying to think, occasionally someone else has, I think maybe Brett Cease has done them. I can't remember who else, but it seems to be largely Ellie.
That's who I'm getting the emails from, it seems like. But maybe we can kind of go through Charlotte. And if Charlotte doesn't pick up on it, I'm pretty sure we could ask Elizabeth Dell, who's my regional coordinator, and I know she would help facilitate that.
That's fine. Yeah, I know Charlotte's dealing with a few personal things right now, health issues. So yeah, she's been
Really?
with that. Yeah.
Okay, then maybe we try to go a different route and maybe
Yeah,
go if that's interesting to you. I don't want to push you, but if you decide that's something you want to do, that would be something else to do. I think people are are very, very interested in the health voice and getting it out further. So we did booth recently in Lansing that there were a lot of CCLers there. There are a lot of other environmental groups. But afterwards, Elizabeth contacted me, again, our regional coordinator, and said, we had this interactive, you guys have seen the CDC wheel, right? So we blew it up really big and we had it on a whiteboard and magnets. And we had people come up and use the CDC wheel for them to start identifying health impacts in their day-to-day life and put a magnet on things that they've seen. So it kind of opened the discussion. It was very interactive. I don't think the CDC wheel is all that great for stimulating that, but she was really excited about it and thought that maybe it would be a way, something that we could put together for tabling, some sort of we could work with their marketing things and come up with something like that facilitated, essentially helped people connect the dots towards health impacts that people are starting to see. Just something else that might kind of be interesting in a way to get that health message out. I know, Lori, you did the flags. That was pretty cool.
Yeah. At our conference in Montana, we had a map and we asked people we had 4 different color pins and we said, if you've seen this in your town or your area, been exposed to this health risk. So we had wildfires and flood and extreme heat and something else, I think. And so there's.
I like that. Then you get the geographic distribution. That's a great way to do it.
Yeah. I think that's something I should maybe introduce to our chapter here.
So are you proposing that if they'll let Nikhil be on the Tuesday call and talk about this, right? And so let's not do it until after that, but also after that, because I know myself being the most recalcitrant of group leaders, I'm not ever on that call. But we can also post in the group leaders site. So if Nikhil can't, we can post for him, and do a post about it too. Because I do think there's probably a fair number of us not on that call. When I did used to attend, there wasn't that many people on the call. So I think a lot of people maybe don't get on it. I don't know.
I don't know. I think, well, I haven't been on it a lot because I'm not leading my group anymore. But Deirdre, how many are on the group leader calls? It seemed like there were a couple hundred or so.
I don't think I haven't seen that many, and it seems to me it's very variable.
Okay.
But I think creating an entry in the group leaders forum is good, because I think most group leaders probably get the daily post.
Digest. Yeah.
Right. I get a list of the groups, the posts that are made by the groups I belong to every day. So I think that's probably worth doing. I think probably trying to do something on the group leaders call is worth doing. I mean, you're not going to get everybody with one strategy, right? You have to you have to put it out a lot of different ways.
Yeah, and one thing, and Nikhil, and I think it's worth waiting until after the conference in November
Agreed.
and actually take advantage of that, because people will be jazzed after that. So,
Yeah,
so
agreed.
sometime in the month or two after that would be a great time. Maybe not right after, but somewhere in that timeline would be a great time.
Right. Yeah, it's such a weird time of the year because I mean holidays are coming up and I just want this to remain relevant in people's minds. Still be
I
able to
wonder,
enjoy the holidays, but
I wonder if you could tweak it a little bit to make it you know, New Year's pledge kind of thing.
okay, yeah, I can
You know,
see what I
protect
can.
your health by protecting the planet. I don't know. Not the most creative, but
I have to say that I have determined after many years of being a group leader that there is no good time of the year. You know,
True.
people there's always something. And I think you just have to, pitch it and keep at it.
Yeah, yeah. That's what I'll do.
So,
Yeah, but Lisa, I like your idea. Maybe turn this into sort of a New Year's resolution.
yeah,
yeah,
and
that's what I was thinking. But I also agree with Deirdre. It's hard to pick a good time, and it may take
Yeah,
more than
yeah.
one. It may take more than one post on the forum, and they'll probably not let you do more than one. I don't even know if they're letting you do that now, but they may not let you do. Are they, more than once pitch it on the call? They'll probably only let you pitch it on the call once, on the
Mm.
group leader call once, but you can post it on the forum many times.
Yeah, yeah. I think what would be nice is I pitch it on the group leader call and then continue posting about it so it keeps popping up in people's inboxes.
Yep, yep. And the
Do you,
template you've put together is really great.
thank you, thank you. Can one of you maybe share the link for that form? I'll see if I can try to join it.
I think you have to be a group leader. Are you a group leader?
No, Charlotte is technically the group leader.
Okay.
Could Charlotte make you a co-leader?
So that is actually what I'm working on. Is I've been doing the emerging leader training, and that's what we're trying to work on getting me into is a co-leader role. So I'll see. Actually, I might just reach out to her anyways and see if there's some way to get me added to that group leader forum.
I don't think you have to
Did you
do the group leader training to be named a co-leader. So
Okay.
you might be able to get access before you complete that whole training cycle.
Okay. Yeah, I'll reach out to Charlotte and see what she says.
so Nikhil, the other thing that Lori or I or Lisa could do is recommend you to present to that group as
Please.
co-chairs of the health team, and that will help. And then you don't have to deal with the group leader dynamics.
That would be perfect. I think that would be a better route to do actually. That way there's some more credence to, why I'm presenting this.
Lisa or Deirdre, are you willing to make the ask of asking if he can be on the call?
I'm fine with it. Deirdre, if you want to do it, you're welcome to, whatever, but I'm fine doing it.
Yeah, if you would, that would be great.
Yeah, I'm happy to do that. Just if it gets off my radar, let me know. Remind me, please. But I don't think actually maybe what we should talk about is the timing when you'd like me to ask so that it's a good time for you too. But I don't think it'd take me 2 minutes to ask. So
Sure.
happy to
Yeah,
do that.
I think let's hold off until after the fall conference because I know I have
Sure.
a few things going on as well.
I bet.
So that will be a good time, I think.
But you
What I-
could ask before then, because she could have things, she might allot 2 or 4 minutes of every call
Sure.
and have it booked
Yeah.
up for a month or two, so.
Sure, yeah. That's fine, Lisa. If you want to just go ahead and reach out to them and just make the ask so we can at least have me scheduled.
Okay.
Perfect.
Do you want to talk any more about your concept?
No, I don't have anything else to add. I think, once we roll this out to the group leader forum, then that will at least help us get some traction. And then in the meantime, I will also work on getting this template shared with the health action team, posting it on our group forum.
So is the purpose what you're looking for? Are you trying to promulgate this template to be used more, or are you trying to get more healthcare professionals into the health action team, or both?
Well, primarily, your first point is we're trying to get more folks involved to be authors. If that inspires them to join the health action team, then I'd be more than happy for that to happen.
The reason I ask is I'm on the Catholic Action team too. And
Okay.
we had Charlotte as a presenter, and we actually had to work on writing an op-ed within that period of time. And so that one was focused more because we were going into the season of creation and everything, with the World Day for Care of Creation and all, and then that whole season. And and I know they're like templates sometimes, I guess, on the CCL website. But if it's a case of just kind of getting the idea of this template out, if this is posted on the can this just be posted on the CCL website, the template, and just let people know it's there then with other templates, or
I think it probably will be part of the media template.
Yeah.
I would guess that's kind of what at least that's what I thought Charlotte was kind of proposing. Maybe I misunderstood.
Yeah. I don't think the goal was to necessarily go through official CCL channels for this, but more to target just the health action team and any other healthcare professionals.
Well, I think if Charlotte knows, I think I calculated out before, if we have 200,000 people in, don't we, in CCL?
Over that, I think.
That means we have 20,000 healthcare providers, and we have 400 on the healthcare team. So only 1 out of whatever, 80 or something. 1 out of 100 healthcare workers are on our team that are in CCL. So,
I
maybe
forget how I got onto it. I don't know whether I saw it there.
I
got a email from Lisa or something. I don't know. But at first you hear, but you don't realize there are these different different teams. Right. And it was only when they had the sponsored one from Catholic Covenant, Climate Covenant, and CCL Catholic Action Team, and they had a whole workshop, which was really excellent. It was all online, and I'm there, well, where's this Catholic Action Team? And then I found out. So it was trying to, at least sometimes I think it's a case, you look through a whole list of different action teams, and unless there's something that will really catch your eye, I don't know, how to make it stand out a few times, or you may have to go maybe to some professional, not like the New England Journal of Medicine, but some of the other healthcare publications, and put your letter in or something and try to attract, even to the CCL and Health Action Team. I mean, I was amazed just with your group here. I didn't realize how much was going on in healthcare, for climate and that. And
I don't think many people know.
No.
I really agree. I mean, I think the amount of work that, a variety of us are doing, both on a state level and with the Medical Society Consortium, and Lori with the pediatricians, and, there's a lot of work happening that I don't think CCL knows that much about. Lori, Rob, and I are trying to keep them, in the loop, but everybody's so busy. And the one thing with CCL, which I love and which is also not great, is that there is such a plethora of information that nobody can know it all. It's overwhelming sometimes. What I love about this idea, Nikhil, is that, if we can get group leaders and or media people talking about it as part of a month, as part of maybe there's a month where the month that you bring it up, maybe the following month it could be part of an action thing, and suddenly it would get out much broader what you're working on. I think if we can find ways that we start doing things that actually interface more directly with the volunteers, it might be really interesting, because the health messaging is an important part of moving people.
What about finding out if one of the Saturday conference calls, the all CCL conference calls, is planned to be about the health effects of climate change?
We have tried that, but I think it's a good idea to revisit it, Deirdre.
Yeah.
We had brought up a couple different ideas, and Natasha had done it. Natasha Desjardins has done that several times, but I think at least twice on those calls. But I think we were thinking about like Renee Salas, but Renee is a little bit intimidated, I think, by our more focused policy aspect. And I think if we were to ask somebody like her, what we really want to get the message across is we're just talking about health impacts of climate change. But you got to get that approved by Mark Reynolds.
So, I mean, try it again and see, because then you could attach to that as the monthly action, or one of the monthly actions, the template.
And if we manage to also revamp kind of a interactive thing, either like you'd have, Lori, where you have like 4 or 5 health impacts that people put in geographically, and or a variety of possible health impacts that people put their things, either way, some sort of interactive thing that they could start using tabling. That would be a couple different ways that a general CCL volunteer could help. We would be helping them articulate the health impacts of climate change. I think that's a good idea, Deirdre. What do you think, Nikhil?
Yeah, I like that. In fact, I'm considering bringing that up to Charlotte and doing that as a tabling event for our chapter. Yeah, I really like that idea. Because
Anybody
so
have
far, so far the focus has been, so heavily on the policy asks, coming from CCL, that the health impacts have not been acknowledged as strongly. And once you start talking about health, then it gets people really opening up.
Yeah. given
Also,
that,
trusted messengers, I mean, doctors and nurses are trusted messengers, as far as I can tell, on almost any subject.
Yeah, yeah.
But certainly on this one.
given that Madeline loves Jonathan Patz, maybe we should bring that up too. And Jonathan is really good about, looking at the future,
Solutions.
the future,
Yeah.
yeah, solution focused.
That might be an idea. I guess I think Madeline, Madeline's not in her old position, but I'm sure that Mark would still appreciate, what she suggests, and she certainly has a good relationship with Jonathan. And I think his presentations are pretty simple. He presented, once a long, long time ago at one of the national conferences. Is that
Another
what you're thinking, Deirdre?
I should remember what the name is, but I can't remember who he is.
He's with the Wisconsin Global Health, the University of Wisconsin Global Health something, department. And he's well known. He's been on the IPCC. He was, participating in the IPCC when they won the Nobel Prize, and he's done TED Talks, and he's pretty well known. And he did present to us once at a national conference for a few minutes, like 10 minutes.
Yeah. And the other person as a potential would be Courtney Howard, who's the ER doc from Yellowknife. And they evacuated the entire town this summer. And her TED Talk on climate change is one of my top 3 talks that I've ever heard in my lifetime.
Oh, really? Wow.
And so I think that the idea of evacuating an entire town when you have one road in and not really even one road out because it goes to nowhere, is just astronomical. And that might be really interesting too. I mean, she doesn't not have an affiliation with CCL, but we have her email, right. And I'm sure that, Kathy in Orlando and stuff knows her, but.
That'd be great. I often use that, remember the ER doc who did the op-ed in the New York Times, Parodi? And yeah. he talks about evacuating his ER, and that it was never taught in medical school. It was not part of his medical school training to evacuate an entire hospital with, flames licking, whatever it is. I quote that all the time when I talk about health impacts involving hospital systems, and he did a beautiful, beautiful job of just really, touching the nerve. But I would imagine this woman, I forgot her name, the one that you just talked about, Lori, from Yellowknife. Mm-hmm. What was her name? Courtney what? Howard. Yeah, I'm sure she would be great. It would be fun to have someone younger and, maybe, somebody different than Jonathan, since we've already heard from him before.
Right. Yeah. And she is younger and it's international, so.
Yeah. Yeah. And if worse came to worse, we could, look for somebody. He says, well, no. Yeah, I think Courtney would be much better. Any other ideas of people? Lisa would be great. Sure would be nice to have, I think it would show a lot of respect to have her.
Yeah, boy, she's pretty overwhelmed. It's unbelievable, how much traveling
she does do a lot. I know she does.
Yeah. She's here this week and she was just up in New York last week, and yeah. Young kids and
somebody we could think about is Renee Salas.
Yeah, I'd love Renee.
Yeah, I mean, and kind of like Lisa, because they work with organizations. Renee is limited because she worked with the Lancet Countdown, and so they're very restricted in what they can say. So,
And I think that would be something we would just have to ask Mark about, because I think people come in and don't talk about carbon pricing. You know what I mean? They don't talk about policy.
yeah, no,
Now, the questions from the audience may bring them back to that, but
no, I can safely say that Renee and others with the Lancet will not address that.
yeah, right.
Because that's kind of political, and it's so.
So what I'm saying is we would say that up front.
Yeah.
When if we were to ask, we would say, we think this person would be a great speaker, but they're not gonna. And correct me if I'm wrong, aren't there other people who do the monthly call who don't ever get into policy?
Right.
Yes, that's true. We had from the Climate Psychiatry Alliance, we had Elizabeth Haas
I
come.
haven't heard her.
She's in Carson City, Nevada, which is very nearby. So she actually came to a community forum that we did on health and climate change, and her presentation was very well received. Talking about the mental health effects of climate change, and also what to do as an individual about the effects of climate change on your own psychological condition. But I just mention it simply because the response to her was so good.
I think
Eco America just came out with their mental health and our claiming changing climate white paper. But I don't know any of the contributors. Susan Clayton.
But Robin will know anybody. I would think that would be a good spokesperson. Rob and I decided at our meeting, Rob and I decided that in general, psychologists aren't that great of a speaker on climate change. I don't know. What was your idea, Rob?
Well, when Susan Clayton talked at the national conference before.
CCL?
Yep. And she's so I understand that, but the problem is that is so overwhelming, and most of our states, I'm biased because Montana's ranks right up there in this one, don't address mental health
at all.
At all. Yeah. So putting that out there as, oh, well, this is affecting our mental health, we need to do that. But at the same time, we also need specific steps that people can take.
Action.
Yeah, we need action. And
action is the antidote to despair.
Yeah, but in mental health realm, that's a tough call.
Mm-hmm.
So we acknowledge it, we do it, but I don't think that is a something we focus around.
But Deirdre, you said that your team did really respond to. Have you guys heard Elizabeth Haas or no? Other than Deirdre, I haven't ever heard her.
I don't know if she was recommended by Robin Cooper.
Mm-hmm.
And we had not heard her before. We went on the strength of Robin's recommendation.
Mm-hmm.
But she was quite a dynamic speaker.
Oh. Why don't we ask Robin?
Yeah.
because she understands both sides of this, of, you know, stimulating versus depressing.
Morbid, yeah. I love the idea of Elizabeth, Deirdre, and I think you're right, Rob, that we can also run that by Robin. I think she's obviously a great resource. And then I think we could think of it, you know, a mental health one and a non-mental health one, you know. The pediatrician angle is always a strong one, Lori. I think that really, really, really moves people.
Yeah. I think that's right.
Yep. People cannot stand anything happening to their children. It will really get them talking.
Has Mark asked for you guys to talk about your Montana experience at the national meeting or on one of the monthly meetings or something?
You
We
did.
talked, Ricky
talk
brought
about-
at it.
Yeah.
Pardon me?
You did
He
talk
brought
at
me
one
at
of
his
the
talk.
monthly meetings, didn't you?
Or the weekly calls, whatever they are. Yeah, our monthly calls. Yeah. Next September,
Okay.
maybe.
Okay, I must have missed that. Sorry. I was just thinking that might be, well, you've already done it, so there you go. Good. Because that's really an inspiring story. Well, these are all great ideas. You know, ways to engage more directly with the overall CCL team.
We can contact Courtney and just ask if she would consider it if we get her on the agenda.
Yeah, I don't know which way it's better to go, to ask Courtney first
Yeah.
and then ask Mark. Or to
Yeah.
ask Mark and then ask Courtney.
What
I don't know which way to go first.
What about asking Mark to listen to Courtney's TED Talk?
That's a good idea.
You know, say that you really think she'd be a great, you know, monthly presenter, monthly guest.
That's a great idea, Deirdre.
You know, here's her TED Talk. You know, take a look.
Okay, guys, educate me on, I can't keep track. What's Mark's role now?
He's back to being executive director.
All right.
And I understand, I think I learned this on one of our group leader meetings. You can stay on the call afterward, after, you know, that the call is officially over. And it's called the Omni Bar. It's like when people go to the Omni Bar, the national conference, and just, you know, chat. And I think at one of the Omni Bars, I was told that CCL had actually engaged a firm to look for an executive director, because it's, you know, a headhunting firm to look for an executive director. So they're going outside the organization and looking for, you know, a strong executive director from the wider population.
Sorry about that.
Yeah. So, and people seem to be happy about that, because they felt that the organization had gotten large enough that we really needed, you know, a special kind of person to, you know, to step into that role. So, but Mark, I think, is going to has agreed to stay on until they find, what I've heard is that Mark has agreed to stay on until they actually go through the search process and find a successor.
Are they not, is Tony not up for it? Tony Cerna? Did they bring up his name at all? Because I would have thought he would be next in line. And to me, he really, I think his way of carrying himself reminds me a lot. You know, he's just carries such a degree of calm and integrity and that sort of thing. But he was never brought up in the discussion, Deirdre.
I haven't heard that. You know,
Okay.
he may not
That's
want
just me
that.
guessing. I just love him. And I've always thought, oh, who would take over after Mark? And then I thought, well, if it were me, I'd pick Tony.
Well, so, and I mean, don't share anything that you're not supposed to share, but what happened to Madeline?
I don't know. I have not heard anything. I wouldn't be surprised if Madeline just, had burned out. I mean, when you think about it, here she was stepping into Mark's shoes, which was a big, that's a really tough thing to do. And as soon as she did that, COVID hit. And with that, financial problems hit, as they did all nonprofits. And maybe Madeline had just gotten to the point where she felt that she couldn't continue to try to lead the organization. She just didn't have enough left to do that.
I think
Is she still involved?
they put a, pardon me?
She's still with us?
She's retired completely from the leadership of CCL. She says she may volunteer and we might see her in Wisconsin some, as a volunteer with her chapter, but she's retired completely from the leadership roles. And I think you're right, Deirdre, from what I've gathered. And, I think they invested a tremendous amount of money going through budget reconciliation to try to get the carbon price, which we got within one vote, but it wasn't, I know, can you believe it? But it didn't happen. So I think that in addition to the pandemic really leveraged the organization and required them letting go of people, which I think was an incredibly painful first time ever thing. So I don't know if that's why, I don't talk to her regularly or anything. So I don't know if that had anything to do with it, but I can imagine it was stressful and hard.
Yeah. I mean, I think, I cannot imagine having a harder job as your first
Me either.
go round in that kind of position.
And I think if you look at the difference, Mark would go, his job prior to this was, he went into big corporations and he was a consultant and told them how to be more efficient. He was all about running and organizing people. That's what he did. Madeline was a kindergarten teacher and a brilliant and beautiful and wonderful kindergarten teacher, but probably did not have the background of, how do we, and I don't mean that as, I'm just thinking after 30 years of looking through a microscope, I know nothing about finances, and would never want to be put in that kind of position. But I'm making all this up. I have no idea if that's accurate. I'm just guessing what would be really hard.
Yeah, I think we all are.
And Nikhil, you got us all talking and thinking about a lot of stuff.
That was the idea.
Yeah, this was actually good to have a chance to talk some.
No, I'm glad that, this was able to stimulate some discussion. Ultimately, I want as wide of participation as we can get.
Well, let me know. I mean, you wanted me to go ahead and reach out to Ellie to see about you potentially being, okay, I will do that. Thanks for everybody's ideas. Anything else we should cover? 9:30. 9:30 here, 8:30 elsewhere.
9:30 here too.
Are you in Kentucky? Are you
9:30, 9:30.
9:30?
6:30.
Lucky. All right. Well,
Yeah.
thanks, folks.
Thank
Thanks
you
for
all.
doing that. Great. Alan, hang in there. You are so tough.
Trying to.
Keep up the good work.
Good night.
Thank you,
Good
everyone.
night, everybody.
Good night.